Good afternoon, everyone. Thank you for joining us for our monthly stroke education meeting. My name is Jakayla. I'm an occupational therapist here in inpatient rehab. I'm normally on the second floor, so if I haven't seen some of you, that's probably why. Our topic for this month is home modification for stroke recovery. So let's get started, and feel free to ask questions as we go, or you can save them for the end. So when looking at going home, there's a couple of questions that your therapist, your nurses, or your doctors might be asking, or you and your family members might be asking these questions as well. And one of them is, are you even able to go home after you have this stroke? And would you be able to live alone? Is someone gonna have to be there to help take care of you, or would you be able to live alone? A big question that we normally ask is, can your home be modified? And what modifications would we need to do to make your home safe, accessible, and allow you to function with the most independence? So that's what we're gonna focus on today. Yeah, these are the three primary elements that we're looking at: safety, accessibility, and independence. And a lot of the things that we're talking about overlap. So it might not just be a safety thing, it might be a safety and an accessibility thing. Or it might be accessibility that also helps to increase your independence. So they kind of go hand in hand, but I have them divided up a little bit for this presentation. So when we're looking at safety, there are some things that are easy to fix, some that are a little more complicated that might take a little more money, or you might have to hire someone to help with the modification. But a few things that we can do that a lot of people may not think about is removing throw rugs, bathroom rugs, entryway rugs, and floor mats. If you step on it and it moves even slightly, you want to move it. If it curls up, take it away. If there's any chance that you could trip over it, have your walker get caught on it, or you can't even roll over it in your wheelchair, it needs to go. A lot of them are for decoration, and we know they look great, but when it comes to safety, safety's first. Aesthetics and cosmetics come second. Adding lighting is a big thing. I hear a lot of people say, I was trying to get up in the middle of the night, go to the bathroom, I didn't want to turn on the light, and I tripped over something, or I got tangled up in something. So adding extra lighting, lamps, night lights, plug-ins, even like the motion sensor lights can make a huge difference, especially at nighttime. And I'm sure if your caregiver or your spouse or your daughter had a choice of whether you woke them up in the middle of the night by turning on a light versus you falling, I'm sure they would take you waking them up anytime. So definitely adding lighting or using the lighting that you have available to you. Another thing that is kind of simple but might cost a little bit is adding a life or fall alert system such as Life Alert. A lot of people that end up going home alone, they may not have their phone with them at all times, or they may feel like, I don't know what to do if something happened. And just having that bracelet or that necklace that says, you know, if something happens, someone could be here within a few minutes, or they would at least know that something has happened. That added safety measure just gives you a little bit more sense of security. And I know a lot of them cost money. You have to pay a monthly fee and things like that. There are a few programs and ways to get around those costs. So if you feel like Life Alert would help you, ask for resources, because the case managers and people like that have all the resources that they can share with you. If this is one safety thing that could help you when you go home, or that would enable you to go home versus having to go to another facility. Some things that are a little more complex that might cost a little more money and also have to have some assistance, like a professional, to do would be installing grab bars and installing a stair lift. And I have images of both of those. A lot of times the grab bar saves a life. So grab bars can be a little more expensive. They're not as appealing to the eyes as the aesthetics, but again, if it comes to beauty versus safety, we're always going to pick safety first. So image of installing a grab bar in the bathroom by the toilet, and all of the images that are included in this presentation go by the Americans with Disabilities Act guidelines. So the grab bars in our bathrooms here, the grab bars that you see in public restrooms, anything that's in a public facility has to go by the Americans with Disabilities Act guidelines. And so when I recommend patients or families to install their own grab bars in the house, I like to recommend these guidelines because they're pretty standard and it's what you've been using while you're in the hospital. So if you can keep it consistent because you know it works for you, that's great. Also for like selling the house, if you have grab bars that are adequately installed and other people can use them, if it's ever needed that you're gonna sell your house in the future, people like to know that these grab bars are up to code. So for installing grab bars by the toilet, we normally get a horizontal one. The length varies, that's not the most important part, but the height at which you install it is very important. So they recommend 33 to 36 inches from the floor, which is roughly about 3 feet. It's normally around waist high for most people. And then having the added vertical grab bar, a lot of people like, but having one is awesome, 2 is even better, but we take what we can get. However, we do not like the suction cup one. So if you only have the option to get a suction cup versus not having one, I honestly say don't even bother with the suction cup ones because they're not secure, they're not reliable, and they will let you fall. So if you get a grab bar, it needs to be securely installed into the wall properly so that if you pull on it, you jump on it, put all your weight on it, it's not gonna budge.
I have a question.
Yes, ma'am.
If you have a little, like it's a toilet closet, so you have a wall on each side, is it good to have maybe the horizontal one this way and the other one long, so you actually have 2 in 2 different spots, or do you want them both on the same wall? Like in the picture there.
Honestly, it is a personal preference. Some people, if there's a chance to have one on each wall, people like that in case they have to use both arms to pull themselves up. Or if you have one like this in the picture, one horizontal, one vertical, only on one wall, it might work as well if you cannot put one
So
on
it
both
doesn't
walls.
matter.
No, it really,
You
honestly,
don't put it on the dominant arm side or anything like that?
preferably, yes, ma'am.
Okay.
Yeah, so if you are weaker on one side and you have the preference and the ability to put a grab bar on your stronger side, it would be better. But if you can only have the grab bar installed on the weaker side, you can always, reach across and just use, because you can still utilize it. Yes, ma'am. Okay, these are a couple of images of grab bars in the shower stalls and in the bathtub, and we're still looking at that horizontal one being same height, 33 to 36 inches from the floor. And if you're doing a bathtub or even a walk-in shower, it's nice to have one that's right as you enter in so you can hold on to it. And then if you can have 1, 2, 3, it's even better. But most people like to have one here so they can at least hold on to it as they're stepping in and out, and then one here that they can reach across and grab for safety. The one here in the front that is horizontal to this one is also very nice, especially if you have a tub bench here and you need something to hold on to in front of you and something beside you. It's nice to have that capability, but a vertical one would also work. And the same for in the shower. I know there normally are 3 different length grab bars at Home Depot and Lowe's, and honestly it depends on the size of your shower or your tub and where the studs are. If you have professionals that are installing them, they normally check for studs, because if they drill them into the studs, they're more secure and they're more likely to last. You also have to check to see what type of walls you have. A lot of people have tile in their bathtubs or in their showers, and some of the tile you can't necessarily drill into. That's why I say it might be a little more complex, because you might have to hire someone. General contractors are great, but if you have someone that just has experience installing grab bars, they'll know exactly what to look for and they can recommend what would do best in your shower that would actually last and not end up coming out of the wall over time because it's not secured into like a stud in the wall. Okay. This is a picture of a bed rail. A lot of people don't think about bed rails for safety or even for independence, but if you have a stronger side and you tend to roll over onto your weaker side to reach over for the bed rail here in the hospital, you go home and you don't have a bed rail, a lot of people have trouble getting themselves from lying in bed to sitting on the side of the bed. This is a bed rail that's really nice because it sits on the floor and it just anchors under the mattress. It can go on any type of bed, any type of mattress. They're very affordable. Different places like Amazon, Walmart.com has them. You just search for under the mattress bed rails and they're very, very user friendly. You can put them on both sides of the bed. You can move it closer to the head. You can move it further down toward the feet, whatever is most beneficial for you. And using appropriate equipment. I like to include this because we compare ourselves to other people. We see people walking with their walker or walking with their Hemi walker versus we might be using the wheelchair and you want to do that one where we might need to do this one. So using the appropriate equipment is going to keep you safe. If your therapist recommends you go home using the wheelchair, go home using the wheelchair, continue therapy, and continue the recovery process, and then I'm sure you will progress to either like a Hemi walker for your stronger side or a full walker, cane. There are many steps of progress when it comes to stroke recovery. So a lot of people get disappointed because they're going home at wheelchair level, but that is okay. And if that is safest for you, remember safety comes first. We want you to be able to navigate your environment, your house, the community safely. And a lot of times the wheelchair is safest for uneven surfaces, rocks, grass, cracked pavement, different things like that. So always use what is recommended for you. And if you have something at home, say you have a Hemi walker at home and you want to be able to use it, talk to your therapist here when you're in rehab and talk to them as you continue to do home health care and outpatient therapy, and ask them if you can practice with the therapist and progress. And when they are ready for you, they'll say, okay, you don't need the wheelchair anymore, you'll only use this. So try to stick with what is recommended for you for safety purposes. When it comes to accessibility, we want you, of course, using the adequate equipment, as I mentioned just before. We also want to make sure that frequently used items are at the appropriate height for you. So if you're in the wheelchair going home and your microwave is up above the stove, that could be problematic if it's not safe for you to stand up and reach into the microwave. So if you use the microwave frequently, we want the microwave to be at wheelchair level or at chair level. Same for dishes. If they're up in the cabinet, it's not feasible for you to try to stand up every time you need your cup or your plate or your bowl. So if you can have the most frequently used items in your kitchen at countertop height, then you'll be safer and a lot easier to access the things that you want to use in the kitchen. Same in the bathroom, towels, clothing in the closets. You want things to be at the right height for you. And a lot of times that just might mean moving them and taking them to a place that didn't used to be their home, but during this recovery process, they have a new home because it's most accessible for you. And rearranging furniture, making sure you have clear pathways, removing those rugs, as I mentioned before, makes your home accessible. So a lot of times we have nice bedrooms, but we have nightstands, we have beds, we might have an extra dresser or a chest or TV stand or chairs, and eventually that nice big room has become very crowded. And walking, you got through just fine, but the wheelchair is wider than you are, so you might have to rearrange the rooms to at least give you clear pathways to go to the places that you're going to use the most. If you never go to that closet, then you don't have to worry about having access to that closet. But if that's the closet you go to daily, we wanna make sure you can roll up to it or walk up to it, depending on the equipment that you're using. It's accessibility when it comes to using the toilet. A lot of people have closets that aren't toilets in the closet that aren't accessible. They're really tight spaces, so they, one, can't get a grab bar in there, and two, can't get into the bathroom. So you can always use a bedside commode. It doesn't necessarily have to be over the toilet as seen in this picture. You could always put it in another area that's easier for you to get to. But having the arms on the bedside commode sometimes substitute for not being able to use the grab bars on the wall. So a lot of people don't like the way it looks. It's not aesthetic, but it's very functional and it helps increase your safety and your accessibility. And also using the tub bench to get in and out of the bathtub. If it's the only means of showering that you have is using a tub shower, but you're not able to step into the bathtub, the tub bench here is a nice transfer seat that you can just sit on the edge and slide in, swing your legs over, and it's a lot safer and it makes your tub shower accessible to you. I know a lot of insurances don't pay for the tub bench, but they're fairly affordable on Amazon or Walmart.com for $50, $60, and for people that need it, it's very, very beneficial. These are a few different types of shower chairs. This one on your right is one that we see most commonly. It's small, can fit in most showers. We have a lot of them here. And as you see here, there are grab bars nicely positioned behind and beside the shower chair. For people that need a little more assistance, we have rolling shower chairs. Insurance doesn't pay for any of these, so it's just about what you can afford and what you need to make it safe and accessible for you to take a shower. So this is also a toilet chair because it has a cutout here. It can be rolled over a toilet or it can add a bucket, and you could use it as a portable toilet chair. If you're needing a lot of assistance, this is a good one because it has wheels on it. Someone could roll it to the bed for you. You can slide over onto it and then they can roll you into the shower. So there's a lot of different types of equipment available, and a lot of times we don't recommend it because some of them are pricey or they may not be at the level you need. But if we are recommending something for you to go home and you're not sure what the other options are, just ask your therapist or ask your nurse or even ask the doctor, what else is out there, and we can show you a lot of different options that might work better for you in your home environment. And also a stair lift. A lot of people haven't seen these, but if people that only have their bedrooms on the second floor of their house, not necessarily an apartment, but a house, these are called stair lifts, and they are definitely pricey. They start at around $5,000. But for people that this is the only way they can go home is if they can get up those stairs, and it's not safe for them to walk up the stairs, they have these chairs that they install, and you press a button and it just drives you up the stairs, and then you get off and get onto your wheelchair, your walker, and vice versa for coming down. So there are options for anyone that needs other types of assistance, and sometimes the finances may not align, but if you need it, it's out there. We just have to know how to find it and how to get it. Okay. Doorways are one of the biggest barriers for getting into the bathroom. A lot of homes that were built before 1990s, 2000s have those nice toilet closets that I was talking about earlier. Nice little tight space for the closet. The door sometimes swings in, gives you even less space to get in and off of the toilet. But doorways are the main concern that I have with patients that are going home at wheelchair level. So I always tell their family members, if you can, measure the doorways and see how wide it is. So the standard for the American with Disabilities Act is 32 inches, but a lot of people can get away with having a 28-inch doorway if you're a little narrower and your wheelchair is a little bit narrower. But if you have a wider wheelchair, then you'll probably need a 32-inch clearance. And that is the inside of the door frame to the inside of the door frame. And when the door swings out like this, it takes away a good 2 inches of room there. So a lot of people end up having to take the door off the hinges because of the way it swings in or out, and to give them more room to get through the doorway. A lot of people, for minor adjustments, will take off the bottom half of the molding on the doors, and that gives you another 2 to 3 inches on each side, and it'll allow you to get in and out of the bathroom, or most of the time it's the bathrooms. Sometimes it's the pantries or like closets, but most of the time it's the bathrooms. So the only problem that I've run into is when people are renting homes, landlords aren't always happy about you changing the doorways or them having to do extra work or modifications. But if you have a doctor's note, most of the time they'll do something to work with you as best as you can. Most bedroom doorways are wide enough. A lot of them have the French door, so it's usually the bathroom that gives us the most trouble for wheelchairs. If you're using a walker, a lot of people can normally turn sideways and kind of sidestep into the bathroom and get in there and not have to worry about changing the doorway width. And ramps. So stairs, or just a few steps, so to speak, is another thing that causes people to not be able to go home. They have difficulty because there's 2 steps to get into the house here, there's 2 steps there, and inside there may be 2 steps down and 2 steps up. Multi-level houses, depends on, if the house is built on a hill, how many steps they'll have. So a lot of people end up having to have a ramp installed in order for them to go home. And the ADA ramp guidelines is easy to find online if you Google it. So a lot of people that put in ramps at home make them too steep. They're too short for the amount of height that you have to cover. So the rule of thumb for a ramp is for every 1 inch of rise, you need at least 12 inches of length, or run is what we call it. So it's kind of a 1-to-1 ratio, 1 inch per 1 foot, you can say. So if your steps are 4 inches tall, there might be 2 of them and 2 inches each. So they're 4 inches tall from the ground to the top of those steps that you need to get up. You need at least a 48 inch, 4 foot ramp to give you the right slope to be able to propel your wheelchair up that slope. If the ramp is too steep, even if someone's pushing you, it's gonna take a lot of effort to get up that ramp. And you have to make sure it's wide enough, and there are certain rules that if it's so long, you need to give little landing breaks in the middle to allow people to take a break. So there are a lot of different ramp guidelines, and a lot of people have to talk to their HOA, because putting ramps in the front is a HOA thing, but most of the time you have a doctor's note, you talk to your HOA, that gets covered really quickly. For public places that you might have seen, there's not enough room to make a long ramp to give you the amount of space that you need, so they do a lot of curve, or the turn, you have to turn. It's because they don't have enough space to give the run to rise ratio that is required of the ADA guidelines. There are a lot of portable ramps that are available if you have the concern that you need to get a ramp for you to be able to access your home by the wheelchair. Ramps.com is a good place to start. I recommend it to a lot of people. They have rubber ramps, metal ramps, wooden ramps, and they all can be anchored in and moved if necessary. Most of them don't have handrails, but as long as they're wide enough and they give you the right length and they're secure, they're not gonna wiggle when you roll onto it or move, then it's okay. There are not as many guidelines for portable ramps as they are for the stationary ramps that people build.
Is that the right website with an E instead of an A?
Nope, sorry, it should be ramps.
Ramps.
Yes, www.ramps.com. ramps.com. Okay. And then last, we're going to talk about independence. So safety and accessibility are all a part of independence. The safer you are, the more you can access your home and move around, the more independent you're going to be. And most people want to be able to do as much for themselves as you can. We focus on independence a lot when you're in rehab, so hopefully by the time you get home, you're able to do all the things you were doing prior to having the stroke, but sometimes you need a little bit more help, and most people don't like to ask for help. So independence is big. For people that aren't completely independent, they still need maybe a little bit of physical lifting assistance, or they need help with their cooking, or they need help with cleaning, things like that. It is one of the barriers that can cause people not to be able to go home after having a stroke. To help with your independence in the kitchen, if you're using a wheelchair and you can't put a plate on your lap, it can change your ability to be able to live alone. Versus if you're using a walker and you are able to get a walker tray and be able to move around your kitchen with your food from the microwave to the table, things like that. So I know there are trays for walkers. I don't know if there are trays for wheelchairs, but there may be a lap tray that is more stable and you can put on your lap if you're moving around in your wheelchair. I know there are a lot of cup holders and bags that you can put on wheelchairs and walkers alike. And I know Amazon has a ton of them. I always say Amazon because I love to shop on Amazon, but I don't get paid for Amazon, so you can use whatever website you can find. But most of the time when you're hands-free, your safety is still intact, and we're not worried about your safety with you trying to use the walker with one hand and carry your drink with the other hand, or vice versa, trying to push the wheelchair with one arm and holding your drink with the other hand. So we try to keep it hands-free to help increase your independence while maintaining that safety. So when we are going through our therapy sessions, we get a lot of advice from physicians, maybe your therapist, the OTs, the PTs, the speech therapists, the nurses, recreational therapists, respiratory therapists. You get a lot of advice, and the best thing you can do is write it down, share it with your family, and use it. So we recommend a lot of the things that we think would allow you to be safe and independent and access your home when you go home. So whether it's a wheelchair versus a shower chair and a tub bench, different things like that, medical equipment, even just like handheld shower hose versus using a standard shower hose. We recommend a lot, so try to utilize the advice that your therapists give you, because they go to school for years to learn all of this stuff. And yes, technology and equipment changes, but we try to stay up to date with things as well so that we can recommend it to you and let you know what the latest is out there. So take the advice that is given from all of your healthcare professionals while you're in rehab. If you go home, you have home health care. If you go to a skilled nursing facility, you get continued care. Or if you're an outpatient, there's lots of advice to receive and lots of resources to utilize. These are a few of the resources that I would recommend for you. The Americans with Disabilities Act. If you go to the website ada.gov, you can find all the guidelines for installing grab bars, for the bathrooms, for ramps, for doorways. They have guidelines for everything and compliance. If you're ever in public situations and they're not up to code and not compliant, there's a portion of the ADA website that you can go to for that, to make recommendations and referrals for them to get up to code. Also, the American Stroke Association and the American Heart Association also have really good resources. One of the handouts I gave you came from the American Stroke Association, and there's questions on the back for when you're going to the doctor, when you're in the hospital contemplating whether or not you'll be able to go home. And a lot of the information from this presentation came from that handout as well. And I believe that is all. Are there